Health Secretary Robert F. Kennedy wants the CDC to stop recommending fluoride be added to drinking water.
Well, the state of Utah will be banning it starting next week. That's worrying health experts across the country, including the state health commissioner. Joining us now is the Onondaga County Health Commissioner. You know her, Dr. Katie Anderson. Good to see you. Thanks for being with us.
Thanks for having me.
So let's start here. Adding fluoride to water has been something that's been happening for decades now. Roughly when did it start? And more importantly, why did it start?
Well, thanks for the chance to talk about something that the CDC has called one of the top 10 public health achievements of the 20th century. It's a really important topic. And it's been around for decades, as you said. The United States first observed in the 1940s, researchers recognized that communities that were naturally exposed to fluoride, because it's a naturally occurring mineral, had lower rates of cavities than communities that were not exposed. And in the subsequent decades, there was more and more research showing that adding fluoride to water could protect children and adults in terms of preventing cavities, and that it was safe. And so based upon that evidence, in the 1960s, Onondaga County joined many other cities and counties in New York State in adding fluoride to our water.
And about how much is added to our water?
It's a very low level. It's 0.7 milligrams per liter. It's monitored very closely, and there's not wide fluctuations. It's a very precisely maintained level. And that's a level that's been studied extensively over the last couple decades and found not to be associated with any significant health outcomes.
But associated, as you said, with health benefits. So how much are those benefits impacting, all of us here?
There's significant public health benefits. So fluoride primarily works in terms of the public health benefit in terms of preventing dental problems and cavities, which is one of the major health problems in kids. It can be painful. It can cause problems with concentration, with sleep, with nutrition. It's estimated that dental problems in kids lead to 51 million missed hours of school per year and $6 billion US in dental costs. So it's a really significant problem. It's also protective against dental problems in adults, particularly older adults who may have issues like receding gums. So fluoride protects everybody.
So both children and adults benefit from that. Any downside?
Well, there's been extensive research, as I mentioned, extensive high quality studies, which is the important thing to underscore, high quality research over the years that has not found any significant health issue at this level of 0.7. There have been some studies that have come out that have been low quality, that have raised some concerns. People may hear about them in the media, that at higher levels of fluoride, there may have been some findings associated with the decreased IQ, other health effects. This has not been found at this level, and again, this has been decades of consensus supporting that there is no significant health outcome, also supported by authoritative reviews from organizations like the World Health Organization, the National Resource Council.
You talked about ages there, adults, children. Any particular communities, suburban, city, rural, higher income, lower income, middle income, that it tends to benefit more than others?
Yeah, thanks for that question. So that's why it becomes a very important public health issue. Research has also shown that children who live in lower income households may have twice the rate of cavities, and you can equate that to then more hours of missed school, more issues with pain, more issues with stigma, other issues with social acclimation. So the benefit of fluoride when added to a municipal water system, again at these low protective levels, is that it protects everybody, including those who may not have access reliably to dental care.
So what do you think the concerns are in municipalities, even entire states like Utah?
Well, I can say that based upon the consensus of decades of high quality evidence, again, those aren't decisions that are necessarily based on evidence or data. We do see examples of where communities have decided to stop fluoridating, and they've seen the negative effects of that. There's an example of Windsor, Ontario, that stopped fluoridating. They saw a 51% increase in cavities over the next 5 years.
Wow.
Juneau, Alaska stopped fluoridating and saw an average of $300 per kid increased dental costs per year.
Direct correlation.
Direct correlation. And so as a local health department, we make decisions for our population based upon the best quality evidence, which here again is that this is very safe, and the benefits are very, very, very clear.
Yeah, and those negative consequences seem to show up relatively quickly. You mentioned the one within 5 years was one of the cases that you gave to us.
That's right, and I mean, you can talk to people who grew up without fluoride or grew up in the context of fluoride, and even the anecdotal evidence bears out. I have those examples in my life. But the evidence is clear, the case studies in our community are clear, so Utah may be making their decision, which is they're right. The local municipalities, as we do, have the right to make that decision, but it's not based on the weight of this evidence that, again, supports this as a public health information.
I was going to ask you, we have time for one more question. Who does have the ability to decide whether we do or we don't add fluoride to the water? Again, very small amounts.
That's an important question. So the federal government has the right to make recommendations, to review their recommendations, but it's the local governments who make the decision. The vast majority of local governments in New York State fluoridate their water, as do we, based upon this evidence.
So county level would have to come from the executive or the legislature, or it's county level?
In our case, it comes from the local health department.
Oh, okay.
All right.
Yeah.
It doesn't sound like there's any immediate change here in Onondaga County.
As always, we will continue to make evidence-based decisions. If the evidence changes, we would revisit. But again, decades to date, the consensus is that this is a really important thing to do for our community.
All right, Dr. Katie Addison, thank you so much for explaining that, taking your time, and for your expertise.
Thanks for the chance.
Always appreciate having you here.